Welcome to U-Report. U-Report is a platform for youth in Uganda to talk about the issues in their communities and to make their voice be heard. We amplify the voices of the community. My name is Melissa.
And my name is Marcus.
And today we will be talking about malaria. Actually, Marcus, last year we conducted a poll where we asked our U-Reporters when they last had malaria, did they have proper malaria medication?
And the result?
1 in 5 said that they did not. Can you imagine?
And that is alarming.
Yes.
Now, most of them said either it was because the medicines were not available or they just did not know anything about the accessibility to the treatment.
Right. And the healthcare centers did not have them.
Very disturbing.
Yes.
Now, we'd love to hear from you. We'll tell you how you become a U-reporter. But first, we hear from our U-reporters on this issue of malaria.
Malaria drugs are there at the hospitals and they are universal. But the problem they have is very many people go there for that service. And sometimes we'll go there and you find the drugs are even not there. They have been finished.
Those people who sell free malaria drugs, I think should be arrested. Because it's like, when you sell drugs, you're like someone who someone who can kill a person. Because like someone who doesn't need some people's lives. Because you're like favoring your own beneficiary, and you cannot care about some other people's lives.
Those people who steal government drugs should be arrested and charged, because they are making the poor people who can buy medicine to suffer a lot.
Malaria treatment is accessible in my area. It's free. In Kasese dispensary, also Nyamamba division clinic.
My name is Omara Daniel. I'm 18 years old. The people, when they see the lame person, they think it got nothing to do. You see me today sitting on a wheelchair, but I'm schooling also. I do like basketball. Playing basketball make me feel happy with my friends. The disabled people, don't sit down and think you are lame. You can't do anything. You can make the world shine.
Welcome back. This is U-Report. My name is Marcus. And with us in the studio today is Hope Achiru. I hope I said the name right. Achiru. Welcome to U-Report.
Thank you so much, Marcus and Melinda. I'm glad to be here.
Let's move to the area of treatment.
Yes.
Is treatment free or not for malaria?
Yes. Treatment for malaria in a public health center or public hospital is absolutely free for malaria.
But if I go to a private clinic, I have to pay?
Yes. Okay. If you go to one of the private clinics, you have to pay.
Doesn't that cause inconsistencies?
It depends. There's some people who prefer to go to private clinic, so they have that option. But no one should be denied access to malaria treatment. The poorest, the richest, no one should be.
So it's not about how much money I get.
No, it definitely isn't. And the quality of the drugs is actually the same.
Okay.
Yeah.
Whether I pay for it or whether it's free.
True.
I find that in talking to many people, I get the response that first they think that you have to pay for it, regardless if it's private or public. Yes. But also this idea that they can't access it. So there's this discrepancy where people don't know that they can get it for free. So what is being done about that? Because the medication is there, the nets are there, and yet people are not accessing. People are still dying.
Yes. The treatment is free, and it should be given to you. You should be able to go to a health facility, government-owned, and get it absolutely free. Now, the issues with access to the drugs. One, they're not enough. I must say that. Like the budget that the government commits to buying medicines is not absolutely enough. So yes, sometimes you will go to a government health facility
and there are no drugs.
And there are no drugs.
That's a problem.
And yes, that is a problem. And then the other thing is that the little that filters through many times is also mismanaged. So you have drugs going out, being siphoned out of the health centers.
These are the cases we keep seeing in the press of medical officers.
Yes.
Well, we definitely are going to investigate more on why young people and malaria seem to be at war with each other. This is U-Report. Remember, you too can be a U-Reporter. Go to your mobile phone, text the word JOIN to 8500. It's absolutely free, regardless of what network you're on. We want to hear from you because your voice matters. We'll be right back.
Every day, about 1,000 children are newly infected with HIV. Most of them are born in sub-Saharan Africa. In order to reach an AIDS-free generation, we must get to 0 new HIV infections. How do we get to 0? Test mothers and babies and give them the medicines they need. Treat and counsel those living with HIV and also focus on prevention. Let's get to 0.
Welcome back to U-Report. I'm Melissa, and we're talking to Hope about malaria and management of free care for malaria. So please tell us now, if it's free, right? Tell us again, why don't people know about it?
Okay. It's unfortunate that people don't know about it, and we should do more in sensitizing people that it's absolutely free so that they know it's their right to get malaria treatment in government health facilities for free.
It's a good
and they are in every single sub-county, county, and district. Everyone should be about 5 kilometers, not more, from a government health center.
So I walked 5 kilometers to get my medication for malaria, and then for some other reason,
it's out of stock.
It's out of stock, or the doctor won't give it to me. Who do I report to?
Right.
Okay. You can report to us, that is to Medicines and Health Services Delivery Monitoring Unit. This initiative was started by the President about 2 years ago because of the same complaints we are talking about. He was just so concerned about people not getting drugs, and yet the budget increment, though little, was being increased towards drugs.
Let's talk about M-Track.
Yes.
I've heard it on the sidewalks, seen it here on a few pieces of paper, and I know it has something to do with malaria, but I have no idea what it is.
Yes.
Okay. What is M-Track?
M-Track is an initiative started by Ministry of Health with support from its partners, UNICEF, WHO, and DFID. So your reporters would really understand M-Track because it's simply an SMS platform.
What issues are addressed with M-Track?
With the community especially, there is also a number that the community can use to send in any issues. It doesn't have to be malaria, it doesn't have to be something specific. So any complaint, any service delivery issue in the health sector can be reported by both community members and health workers. So the number that anyone could pick up a phone and send to is 8200.
That is to send a text
Send
message.
a text, just like you would send a U-report text. Pick up a phone. The health worker is not at the hospital at 9, 10 when they're supposed to be there, send a text. The health center is not opened on time, send a text. There are no drugs, you want to find out whether it's just it wasn't enough or someone has taken the drugs out, send a report. So anything, the health workers are not attending to you and everything like that, send a
I need to ask, is it working? And if it is, do you have any examples to say that here's an example of how M-Track helped?
M-Track is absolutely working. It's been rolled out in central Uganda, so we have Buganda and Busoga covered for now. Health workers are reporting, and so far we have over 25,000 SMSs coming in using the hotline 8200 of community people complaining. And some of the examples is someone will send a message and say, there are no drugs.
Wow, Hope, it sounds like accountability is really being achieved. Yes. Now, is there a toll-free number people can call alongside SMSing?
Yes, there's a number you can call, and it's available 24 hours. You can call at any time. It's 0800 100 447. That's 0800 100 447. Thank you.
Thank you, Hope. Well, you should call because it's important, and you should also SMS join to 8500 to become a U-reporter today. Thank you for watching. Have a good night. Till next time.
Thank you.
The importance of keeping the environment clean is, the most important one is to ensure that we have good health.
It is important to wash hands just because our hands touch very many things. And some of those very many things have germs that cause diseases. And if we wash them and make them clean, we may prevent ourselves from getting diseases.
I've been in a place I went visiting and I couldn't stay for 30 minutes because there were flies and everything was so messed up. And in that same house there was a patient. So I was wondering what is not happening.
It's important to have water in the public toilets, water and soap to wash our hands because it's not safe there. There are germs. We need to wash off those germs that we get from the public toilets.
This is how I would wash my hands. I would get water, I'd pour in my hands, and I would get, after cleansing them the first time, I would get soap, smear in my hands, get water again, then start cleansing them. Then I would get a brush and maybe start passing through my fingernails. But one thing I would advise the community to use is, the best thing I would advise the community to use is to use warm water. Because at least you're sure the water doesn't have the germs and you're washing the germs off your hands.
Welcome back to U-Report. My name is Melissa, and today we are talking about water. Not the typical conversation where we talk about access to clean water or if it's good, if it's bad, and communities and whatnot. But we're having a little spin on it. We're talking about hand sanitation. Are you washing your hands, and what does it mean if you don't? Fortunately, we have a guest with us today to talk about it. Please introduce yourself for the audience.
Hi, my name is Chris Nsubugamuga, and I'm the National Hand Washing Coordinator. Now, I know that most of the times when we talk about hand washing, everyone is like, what? You mean you need a national campaign to wash hands? Oh, yes, we do. You know, because we're losing so many kids every single day in Uganda. We lose about 200 children below 5 every day due to diarrheal diseases and acute respiratory infections. If you bring those numbers home to something we can really relate to, you're talking about 14 Kamunye taxis. You know the Kamunye taxis? About 14 of them in fatal crashes, you know, full of kids every single day because of deaths due to diarrheal diseases and acute respiratory infections. So it's absolutely important.
I am one of those people who struggles to get my head around the concept of a national hand washing campaign. I mean, do we need a campaign to tell people to wash their hands?
Absolutely.
I thought it's common sense.
You see, this is what happens. Hand washing is probably the best self-administered vaccine that anyone can give themselves. Okay. Because hand washing can reduce diarrheal diseases by up to 50%, and acute respiratory infections like pneumonia by up to 30%. So literally this is what happens. You go to the loo, to the toilet, to the latrine. Sometimes we leave that place thinking, I didn't touch it, I'm good. But the truth is that if your hand went back there, you probably touched it.
Back there or front there?
Well, whatever, yeah, wherever, where. Yeah. Because look, in 1 gram of human feces, you have over 1 million bacteria, just 1 gram. And when you complete that fecal-oral cycle at the root, from there, you don't wash your hands, you get your samosa or, this food for the kid, and it goes into the mouth. They can't stand it. They get sick, they die.
When you say
diarrheal
diseases.
Okay, running tummy, you see what happens is when you eat human feces, stool, it causes you a running tummy. Now, for an adult, you know, like Marcus, you kind of will lose a little weight, your pants will sag a little.
So running tummy is not a pot belly that's
no. You lose your weight, definitely. But for the kids, what happens is that their immune system is very low.
Now, is it just washing your hands after you use the latrine or the bathroom, or is it other things? Is it touching a coffee mug and, you know, you now have the germs from the person who touched it before? Yeah. Is it just regulated to toilet use?
Here's the truth about this whole thing. The most dangerous stuff we can ever touch is not an atomic bomb or nuclear stuff. It's actually our feces, all right? And I guess that's why they're made in such a way that they're disgusting. They stink. You need to put them somewhere, cover them, and have them very far from you. Because when they get into your hands, you got all this diarrhea, these bacteria, and all this stuff that causes diseases. Now, here's what happens. I know that tables could be dirty, computer, money coins, could be dirty and all that. But guess what? In Uganda, only 25% of Ugandans wash their hands with soap after coming from the toilet. So imagine if we had a fourth person seated with us here, all right? You would count 1, wash their hands. 2, 3, and 4 haven't. So I would shake your hand and say hi. And guess what you have in your hands?
That's a really scary thought. And we'll come back to that.
I'd like us to count from this side. 1.
And we'll come back with that.
Or how we do break, 1, then 2, 3, 4. Yeah.
So if you want to be a part of the conversation, SMS JOIN to 8500 and get engaged. Tell us what you think about this. We'll be back shortly. Welcome back to U-Report. My name is Melissa, and today we have had such a good conversation. We're talking about hands and how clean they are and how you make them clean. So I actually have a question for you. If I'm a student and I'm, you know, hanging with my friends, and I wash my hands, but I know that my friends don't, how do I engage that conversation? Because it's not really the coolest conversation to have. And when you want to tap my hand and I'm like, I know you didn't wash your hands.
I see it.
How do we engage?
Because the last thing you just walk up to a friend and say, like, hey, have you washed your hands today?
You don't ask that question.
Yeah. Well, I think that hand washing is with soap is not far removed from our day-to-day life. And you know, sometimes you're in office and you go to the toilet with friends or a colleague, and they actually, you know, do the big job or whatever it is, and they leave without washing their hands with soap. And sometimes it's difficult to shake that hand for another month or so because you're trying to get over the shock. But what happens is that if I wash my hands and I tell you about hand washing and I encourage you to wash your hands and we talk to each other about it, if it becomes the habit that we do, the norm, then it becomes easy. So everyone is safe if everybody is washing their hands with soap. You can't long range with this. It can't be like a perfume. I smell nice, you don't. If you smell nice and I don't smell nice, you'll not smell nice if we're talking about hand washing.
Right.
You know, so it's not like a perfume. It's a community thing. So we need to encourage each other. So if you're in a school, you need to talk to your head teachers and make sure that there is water and soap to wash hands, and a system to make sure that the water is always there, that the soap is always there. Let me tell you something. Can I tell you about this tip it up thing?
Because it's technology.
I've seen pictures of that on some calendars, but I do not know how it comes.
So this is what happens. It's a very simple technology. It uses you know, a twig here and there and a small jerry can and soap. So you actually, you know, like this bar of soap that's 200 shillings from the shop, you can actually just cut a third of it and use it on a tip it up. You know, you put a stick and a string, and you kind of step on the little jerry can, and it tips over.
Like
it has a drip
yes,
system.
it's like a pedal
it's very
system.
difficult for me to explain it, but when you see it, it's very easy to make. Yes. So we actually have, in this national campaign, in the areas where we have guys we call hand washing ambassadors, and if you ever see a hand washing ambassador, it will be cool for you to let us know, to let U-report know. So the hand washing ambassadors go to communities and teach people how to construct these technologies. They're very, very easy. And when you have it around you, you always can wash your hands with soap. So the more technologies, more hand washing facilities that are available, the easier it is for us to all wash our hands with soap.
How are you teaching moms how to wash their hands? I mean, what is the technique? Because I'm sure there's people watching now who don't know.
My son could actually teach you this, but it's very simple. So can we just try it together, all right? Yes. So this is what happens. Imagine there's some flowing water, all right? Okay. So what happens is that you make your hands wet under the water, the flowing water. So imagine your water there. Come on, Marcus, make your hands wet, all right?
Feel the water, Marcus.
Yeah, exactly.
Feel the water.
So then you get some soap, all right, and put it in there, and so you form a lather, a chovu. So it's got to be that white form.
So there's got to be
quite some lather, because that's what pulls off the germs from your hands, okay? So then you rub like that, okay? Then you go like that, okay? And then the other way. Okay. Then, the thumb. That's important because you hide the germs in there. And then the other one.
Okay. Now, all three of us have rings. What happens with these rings?
The soap, it helps. Just follow through. Okay. And then you do something like that.
So what's this?
So now what that helps is, it helps you scrub that part, okay? But then also, if you have no long nails, it helps clean that. But then also, if you have, but this really gets petty. But you do that, and then you rinse. So simple. You do that. You do that. You do that.
So really easy.
Finished.
It's like a cool handshake.
Yeah. And so, it happens in under a minute.
So now, when I'm done, what?
Don't touch a towel, please.
What do I?
No, you know that stuff in the kitchen. And all that. No. We actually are telling people to hand dry their hands, because you see, imagine if you went to some of these toilets that we have, like in a hotel or something, and use a towel to dry your hands. Now, let's say I wash my hands properly. But Marcus over here doesn't wash his hands properly. He doesn't even use soap, but he uses the towel. And then you use the towel after him. You got his stuff and you eat it. So just hand dry. Shake the hands dry and you're cool.
And when you say it like that and then you eat it, it just sounds so vulgar.
Yeah.
We're almost out of time, but before we go, Chris, can young people, students, expect their school to provide a hand washing facility? And if I send my child to school and they don't find one,
what do they do?
What do they do?
Yeah. I think, first of all, charity begins at home. It helps if you actually practice hand washing at home after visiting the toilet and before feeding. Because then the kid has the habit.
This is the parent?
Yeah, the parent. Okay, you teach the kid. So you all practice hand washing with soap after the toilet and before feeding. Then when they go to school, they're able to say, look, you want us to have a meal, but I don't have water and soap. So kids are actually very good at agitating for stuff to change, So if I've been doing it at home, I'm going to go to the school and say, Mr. Headmaster,
why don't we do this
where's the water? Where's the soap? And schools are actually supposed to provide for this. And if it's not happening, then teachers, parents through the PTA, the Parent-Teacher Association, can actually put some pressure on the school and say, we need to have our kids wash their hands with soap. What do we do about it? Because there are all those committees within the school, from the community, that work with the schools to make sure that this happens. So I would totally promote that.
Thank you very much, Chris. Now remember, you want to have hands that you can be proud of. So wash your hands every time you leave the bathroom and before meals. Don't. After is good, but before it's kind of
good.
Like
because you don't want to get that
stuff. So wash your hands, tell your friends to wash their hands. And remember, join up and become a U-reporter today. Send a text message to 8500 and send the word join to that number and you become a U-reporter. We want to hear what's happening in your community because your voice matters. From everybody at U-report, thanks for watching. We will see you next week.
Thanks a lot. I won't shake your hands because, we don't know how you are.
We'll just do the elbow.
Yeah, okay, the elbow thing.